Welcome to Environmental Services, Cleaning and Disinfecting of Clinical Office Areas. Today we will be going over proper procedures of cleaning and disinfecting in clinical office areas, or better known as doctor's offices. This video training will help you understand the importance of why these areas require special attention, and why it is important to clean and disinfect these areas daily. So why is cleaning and disinfection in clinic areas so important? Analysts report over one-third of all hospital stays originated in the patient's own private physician's office. Generally speaking, most people would rather be treated by a physician that knows them and knows their individual ailments, instead of being treated by anyone else. Now let's look at why this fact is so vital, and why we must clean and disinfect these areas thoroughly daily. The services that physician offices offer are so wide and vary so much that the possibility of cross-contamination is much higher than even in the hospital environment. Services like well baby and children checkups, routine physicals, and adult checkups are all considered wellness services. Typically, these patients do not have symptoms of illness prior to arriving at the clinic, and do not expect to exhibit any once they leave. However, these patients are being seen in the same clinic as patients that do have symptoms of illness, and may in fact be contagious. So the chances of acquiring a healthcare-associated infection, or HAI, are increased during visits to physician clinics, and are directly connected to the number of pathogens in these areas. These pathogens can be transmitted by person-to-person, or person-to-surface-to-person contact. The chances of acquiring an HAI are greatly increased if proper cleaning and disinfection are not conducted daily. While working in physician clinics, you will also be cleaning and disinfecting areas normally found in hospitals. One of these areas are procedure rooms. These rooms have the ability to conduct less invasive, outpatient surgeries. Although surgeries done in these areas typically are not considered high risk for infection, and are not open wound surgeries. These rooms must be cleaned similar to endoscopic rooms found in the hospital. This includes cleaning and disinfecting the entire room and every area in the room. The systematic approach to cleaning is identical to any other room that you clean. Always start at the door, working in a clock or counterclockwise motion, moving around the room. Always remember to wear proper PPE. Look for identifiers of any isolation procedures being observed by the physician. Place a wet floor sign at the entrance of all doors, and follow what you were taught about how to clean other rooms. Start by removing all trash and biohazardous material from the room. High dust all surfaces above shoulder height. Focus on vents, lights, tops of cabinets, any pictures and blinds that may be in the room. Working from the cleanest area to the dirtiest, wipe all vertical surfaces, which includes walls, fronts of cabinets, and picture glass. Change your cleaning rag when it becomes dry, and before moving to a different step. Continuing to move around the room, using the systematic approach, clean all horizontal surfaces below 6 feet, moving everything that can be moved to clean behind and under it. This will include chairs, surgical tables, counters and procedure bed or table. Always clean top to bottom, making sure you don't recontaminate areas you have already cleaned. Again, changing your cleaning rag when it becomes dry, and before moving to a different step. Wipe all legs, feet and lower portions of the procedure bed or table, ensuring all areas in the room not already cleaned have been wiped. Now, you must restock all disposable supplies in the room, making sure everything is full and ready to be used. This includes paper towels and soap dispensers. Verify that all sharps containers are less than 3/4 full, and replace as required. Lastly, begin mopping, starting at the furthest part of the room, and working toward the door. Make sure you are using proper mopping procedures already taught in previous videos, focusing on figure 8 motions, grabbing dirt and debris as you go. Replace the mop head as needed, ensuring the room is both swept and mopped at once. When you get to the door, remove your mop head, and using your broom and dustpan, pick up all dust and debris from the floor. When you have completed cleaning, stop at the door, turn around and inspect your work. As in any other room you clean, after mopping the floor, and it is completely dry, pick up your wet floor sign and turn off the lights. Other areas that you will clean, while working in physician clinics, are the doctor's or physician assistant's offices and nurses' stations. These areas are just like any other professional office you clean and require the same type of cleaning. Make sure not to throw away any boxes unless it has been marked as trash. Also, do not move any papers or items on the desk while cleaning it. Nurses' stations can become very cluttered with patient records, paperwork for the physicians and general office type of paperwork. Make sure you are following all HIPAA rules and never throw anything away that looks suspicious. Always dust all monitors, and if there is glass windows in front of the nurse's station, clean it regularly to remove fingerprints or anything that gets on it. Now that we have discussed how to clean and disinfect procedure rooms, cleaning of exam rooms will be the next area we will focus on. What is an exam room exactly? The exam room is where the physician will perform most of their services for their patients. These rooms, generally, are smaller rooms, normally with an exam bed or table, a few additional seats for patients or family, a small sink and counter area. Some exam rooms have small tables for personal items, and a biohazard container for sharps or other bio-type material. But of course, the most important thing that every exam room has plenty of is pathogens or germs. The systematic approach to cleaning and disinfecting exam rooms are identical to that of what you have already learned for patient rooms, just on a smaller scale. Always start at the door, working in a clock or counterclockwise motion, moving around the room. Always wear proper PPE. Look for identifiers of any isolation procedures being followed by the physician. Place a wet floor sign at the entrance of all doors, and follow what you were taught about how to clean other rooms. Start by removing all trash and biohazardous material from the room. High dust all surfaces above shoulder height. Focus on vents, lights, tops of cabinets, any pictures and blinds that may be in the room. Working from the cleanest area to the dirtiest, wipe all surfaces, spot clean walls, fronts of cabinets, and picture glass. Move everything that can be moved to clean behind and under it, including the trash can, and spot clean the wall directly behind it. Always clean top to bottom, from the back to the front of the room, making sure you don't recontaminate areas you have already cleaned. Focus on high-touch surfaces, the surfaces that people tend to touch the most, like handles, chair armrests, the physician's computer, and most of all the exam bed or table. Change your cleaning rag when it becomes dry, and before moving to a different step. Now, you must restock all disposable supplies in the room, making sure everything is full and ready to be used. This includes paper towels and soap dispensers. Verify that all sharps containers are less than 3/4 full, and replace as required. Lastly, begin mopping, starting at the furthest part of the room, and working toward the door. Make sure you are using proper mopping procedures already taught in previous videos, focusing on figure 8 motions, grabbing dirt and debris as you go. Ensuring the room is both swept and mopped at once. When you get to the door, remove your mop head, and using your broom and dustpan, pick up all dust and debris from the floor. Do not use your mop head to pick it up. When you have completed cleaning, stop at the door, turn around and inspect your work. Take a moment and picture your own child or parent sitting in this room. Is it cleaned and disinfected, so you would not worry about their health? As in any other room you clean, after mopping the floor, and it is completely dry, pick up your wet floor sign and turn off the lights. Unlike patient rooms in a hospital, most restrooms in clinics are either for public use or for private employee use. Regardless where the restroom is located, cleaning and disinfection of restrooms are the same. Remove all trash and any biohazardous material before starting to clean. Always clean from top to bottom. High dust vents, lights and any surface above shoulder level. Move from cleanest to dirtiest. Meaning clean all areas in the restroom before cleaning the toilet. Focus on places on the toilet that may drip down, as well as the basic use area. Focusing on high-touch areas is essential, and must be disinfected daily. Areas like grab bars, cabinet, and toilet handles, toilet paper and paper towel dispensers, soap dispensers and sink faucet handles. Restock all supplies, ensuring that toilet paper roll is over 3/4 full, paper towels are full and soap dispensers are over half full. When mopping, start from the furthest part of the room, move toward the door, grabbing all dirt and debris. Focus on directly in front, against the wall and behind the toilet. Do not bring your mopping into the hall or room, always keep restrooms separate from any other area you are mopping. When you get to the door, remove your mop head, and using your broom and dustpan, pick up all dust and debris from the floor. Do not use your mop head to pick it up. Turn around and inspect your work. After mopping the floor, and it is completely dry, pick up your wet floor sign and turn off the lights. As we have gone through the physician clinic area today, one of the areas that only employees are allowed to see is the employee break room. This room, although private, requires a fair amount of attention. This area is where the staff may prepare and eat lunch, have gatherings, and visit regularly during the day. It can become very messy, and to maintain the staff's health, is required to be cleaned daily. Here you will need to empty all trash, remove recyclables, high dust, clean and disinfect surfaces, clean sinks, wipe the outside of appliances, and mop the floor. All other areas in break rooms are the responsibility of the staff. They are responsible for cleaning any dishes, coffee makers, inside any refrigerators and organizing all clutter. If the area becomes too cluttered or you are unable to effectively clean the area, inform your supervisor. So far we have discussed what physician clinics are, the reasons why cleaning and disinfection of clinics are important, processes for cleaning procedure and exam rooms, restroom cleaning, office and nurses station cleaning and staff break rooms. The areas that usually get the most amount of complaints, and are the largest areas of cross-contamination are the lobby and receptionist desk areas of the clinic. The receptionist's desk area is the first direct contact patients have with caregivers in the clinic. This area is the first impression point after the lobby, and second to only the lobby the biggest location for cross-contamination. Since every patient must first check in, the front counter is the area that people touch, tap on the window or allow children to touch the window glass. Although the area directly behind the counter is cleaned as any other office area is, the counter area must be thoroughly disinfected, and glass must be cleaned daily. The receptionist's desk area must be high dusted, including behind, around and on top of computers. Desks cleaned and disinfected, glass cleaned inside and out, and the floor must be mopped daily, to ensure the health of staff that has direct contact with patients every day. The lobby usually is one of the single largest areas in the clinic. This area is where patients and families sit before being moved back to an exam room. This area is probably the largest area that pathogens, or germs, will reside. This area is used by both healthy and sick patients, waiting to see the physicians. As you can see in this picture of a typical lobby or waiting area, there are many chairs with armrests and tables. All surfaces primed for pathogens to sit and wait for a host to infect. When cleaning the lobby area, start by high dusting all surfaces above shoulder height, which includes all top of pictures, televisions, vents and lights. The next area that you always must focus on are high-touch areas, like chair armrests, tables, door handles, counter areas and all glass. The floor is usually the very last area of the entire clinic that you should clean, since you will be walking out the entry door, and do not want to walk on the floor when it is wet. Always place a wet floor sign before you start cleaning the lobby, leaving it outside the door leading to the hall, to inform anyone entering that you are cleaning and the floor might be wet. Just as you would do for any other room, when you have completed cleaning, Stop at the door, turn around and inspect your work. Then, after you have completed mopping the floor, and it is completely dry, pick up your wet floor sign and turn off the lights. Clinics are not areas that can be overlooked and should be cleaned with the same importance as any other patient area in the hospital. Proper cleaning and disinfecting are the key to reducing infections. It is your job to ensure you are properly cleaning the areas you are assigned. As an environmental services technician, you are an important part of controlling the spread of infections and a vital part of the infection control team. Thank you for keeping patients and staff safe and healthy every day.